Good morning, everyone. Thank you very much for joining me. My name is Huzefa Hamid. I'm with the Leslie Group, and welcome to today's webinar. Before we get into the content, just a couple of housekeeping items. So it's a webinar just because of the numbers we have on. Everyone is muted, but we really want to encourage you to ask as many questions as you want. So as we're going along, feel free to ask questions. Between Blake and Alison, I'm sure they'll pick those questions up. And we'll leave a little bit of room at the end of the webinar, maybe 5-7 minutes, just to answer any questions that we didn't pick up. And I'm sure Blake and Alison be happy if we go over time just for Q&A. That's absolutely fine. So when you look at the group benefits universe, and just like many other industries, there is just a tremendous amount of information, both in terms of breadth and depth. And if you're a plan sponsor, if you're a benefits administrator, it's very easy to get kind of swallowed up in the details and the day-to-day running of your plans and not ask those strategic questions, and also not knowing where your focus should be. So today's webinar is really about that. It's about trying to figure out what should your focus be moving forward. What are the questions you should be asking yourself? How do you get the most value out of your plan containing costs, and just also the effectiveness of delivering good benefits to your employees, to your staff, to your teammates. So I'm joined today by the very fabulous Alison Cairns and the equally fabulous Blake Robillard. Thank you very much for joining me. They had no idea I was going to introduce them in such a way, so they're a little bit off guard, I presume. But I'm going to hand it over to Alison, who's going to kick off today's presentation. So thank you again, and welcome, Alison.
Thanks, Huzefa. Thank you, and happy all of you could join us today and take time out of your busy schedule. December's a time for reflection, both personally and professionally, where we look back on the events of the year and we set goals for the upcoming year. 2020, what a year. How do you even describe a year like the one we've had? As we look forward into 2021, one of the biggest challenges that we're all facing is the uncertainty and knowing what 2021 has in store for us. And although that's true every year, it's even more true this year. This makes it difficult to plan and set goals, but one of the things I've learned since March and the start of this pandemic is that we are all resilient and adaptable. So planning and goal setting will look a little different this year, and that's okay. As much as I wish I had a crystal ball and I could give you all a glimpse into what the next 12 months looks like, I don't, but what I can share is what we're currently seeing in the world of benefits, both in regards to new trends and emerging trends that continue to gain popularity. Benefits continue to form a big part of people's compensation. In the 2020 Sanofi survey, 58% of plan members rather keep their health benefits than get $5,000 in cash. So what that tells us is employees really value their benefits, and you all play an important role in designing and rolling out those programs. Blake and I had a lot of fun building today's presentation and look forward to spending the next hour with you. Before I get started, I just want to give a quick shout out to Huzefa Hamid here at the Leslie Group, who graciously offered to moderate today's webinar, and for all his efforts in helping us build the PowerPoint. So let's get started with trend number 10. And number 10 is outsourced HR expertise. So who do we see utilizing outsourced HR? The first are companies that are looking for a complement to their existing HR department as an extra resource or for a consultation with an expert. This could be either because the person in the role is more junior in nature or because of the complexity of the situation that they're dealing with. The second scenario are companies that currently don't have an HR department. Most likely they'll have someone performing basic HR type of duties on a day-to-day basis, but this isn't their main role. So their knowledge and expertise in the area is limited, and it's just one of the many hats that they wear. The challenge that this creates is because they don't have the education or expertise to navigate complex situations, it can have legal ramifications if handled poorly or incorrectly. Small business in Canada is huge. Over 98% of all businesses have fewer than 100 employees. So as you can imagine, the majority of companies don't have a designated HR department, or if they do, it might be one person in the department and they could have limited expertise or scope depending on their background and the situations they're dealing with. There's almost 1.1 million small and mid-sized businesses in Canada, and more than half of those have less than 5 employees. So why are companies using external HR? Well, our world is becoming more litigious than ever, and it's created a greater need for employers to have stronger policies and practices in place and ensure employee-related issues are handled correctly. As we reflect back on 2020, no one can argue that our world is more complex than ever. Employers, especially HR departments, were forced to deal with situations none of us had ever seen before. We're now in December, 9 months after our initial lockdown, and our world is still constantly changing. Some of you probably joined us for our webinar in June when the economy was starting to open back up and employers were faced with the issue of calling staff back to work and all the challenges that came with that. We had the owner of HR Primed share his expertise in the area of work refusals in COVID-19 times. 2020 aside, other areas that companies are relying on external HR for are things like day-to-day on-call support, legislative compliance, employee terminations, and progressive discipline, attendance management, and health and safety issues. We like to think of external HR support as really a phone a friend, using an industry expert to help you navigate complex situations. And next on our top 10 list, number 9, working remotely. 81% of organizations are planning to permanently retain or expand remote working. During the pandemic, there was more than 6 million Canadians working from home due to the government mandated lockdowns and closures. And depending on many factors, you may be in a position where you and your team members were never transitioned back to the office or are working in some type of hybrid model. With the latest restriction announcements, some provincial governments have asked that if you're able to work from home, you do so for the next few weeks. For example, the Alberta government themselves have transitioned most government employees to work remotely and will be reevaluating mid-December. So the million-dollar question when it comes to working remotely, is it here to stay? In a Benefits Canada article published in September of this year, Senior Vice President of People at Slack Technologies was quoted as saying, "We're never going back to the old way. The last few months have demonstrated that it's possible for teams to thrive in a distributed model. We're at the beginning of a generational shift and we'll see remote working become much more prominent component of employees' experience." He goes on to say that they've already started to take advantage of all the pluses that remote work has to offer. So for example, employers have a much broader pool of talent to pull from because they aren't restricted to just the city in which the office building exists. The article does go on to mention that remote working isn't for everyone, as some have and other commitments, and it can make it difficult to work from home on a permanent basis. The other challenge that remote working has created for some is in the area of mental health, as prolonged working from home has created heightened anxiety, isolation, and stress. So as previously mentioned, the post-COVID world will most likely look like a hybrid model. Industry articles early in COVID showed the majority of employees, in excess of 75%, wanted to return back to the office. That was in May of this year. By October, less than 40% wanted to return back on a full-time basis. In addition, CRA recently agreed that they will approve up to $400 of home office reimbursement expenses without issuing employees a T2200. So one thing that companies will have to continue to balance is the mental health component of having people work remotely. So we will all navigate it together as we try to accommodate employees that are struggling in the area of mental health and the challenges that working remotely can bring. And now on to our number 8 trend, pharmacogenetics. Pharmacogenetics is the study of how individual genes influence someone's response to medication. In other words, it's a drug compatibility test. Not everyone metabolizes drugs in the same way. By analyzing the way someone's body reacts to a given drug, it helps doctors determine the right treatment with the least number of side effects. Everyone is different, so what works best for one person might not be the same for another. Genetics can account for 20 to 95% of individual variations in drug response. Instead of spending months or even years looking for treatment that works, pharmacogenetic testing can help save time and frustration and get employees on the right drug and path to wellness sooner. What's the value to employers? Well, it's twofold. You can lower your company's drug spend by eliminating the costs associated with the trial and error of finding the most effective medication, as each medication that an employee tries would be submitted through the employer's benefit program for reimbursement. The regular drug rate of first failure is almost 50%. That's a lot of wasted dollars going through the group plan. In addition to a high failure rate, there is a less than desirable efficiency rate. And the problem that can solve for employers is with pharmacogenetic testing, if we can get employees on the right drug, they'll be more productive at work. Plan members will feel better faster. Lost productivity can look different. It can be time away from the workplace due to numerous doctor's appointments and medical appointments in an effort to find the right drug through their trial and error period. It could be sick days. It could be possible short or even long-term disabilities, depending on the severity of the condition. And then another, which is harder to measure, but certainly still exists, is people coming to work but not being productive, so absenteeism. We are also starting to see an uptake of some insurance carriers using this tool in the case management of long-term disability claims where it makes sense. Testing is non-invasive and can be done through just a cheek swab. Although most insurance carriers don't cover the cost of the test, there are some that will cover it in the extended healthcare portion of the plan, provided it's prescribed by a doctor. Many carriers now have preferred pricing arrangements with different pharmacogenetic providers and offer plan members a discount on the test. Reach out to your Leslie Group representative if you think you have employees that could benefit from the testing. Cost for the testing varies anywhere from $300 to $500, and it is eligible through a healthcare spending account if your plan has one. So let's look at a quick case study to show you the impact that this testing can have. So Kira is a medical professional and was diagnosed with rheumatoid arthritis in 2005. She was prescribed a cocktail of medications and has struggled with chronic pain for over a decade. In working with her pharmacist, they ordered a pharmacogenetic test and discovered that Kira has a rare genetic condition that she can't convert the folic acid to its active form, resulting in the ongoing adverse drug reaction. The pharmacist researched alternative medication and confirmed with further lab tests. Within a month of adjusting her medication, Kira's chronic pain has stopped. So without knowing that Kira's body can't convert the folic acid, they never would have been able to find the right drug regime, improving her quality of life 100-fold. So pretty amazing story. So moving on to the next trend that we're seeing in benefits is flex plans. So why are we seeing the trend? Because employees value individual customization, and each employee will value something different within their benefit program. For some, prescription drug coverage will be the most important, while for others, it's parameds. A flex plan or some flex component gives employees that customization. We are seeing flex and individual customization being offered in two different ways. The first is an actual flex plan as we think of it in the traditional sense, and the second is through the introduction of a healthcare spending or a wellness account. Let's start by looking at the first. Historically, only large companies with hundreds of employees could offer any type of flex plan to their staff. It's now become available to smaller employers, which is very exciting. Historically, because of the complexity of the administration, as well as the lack of spread of risk, it was only available to large employers. In about the last 5 years, we've seen multiple solutions hit the marketplace, allowing employers with as few as 3 employees be able to roll out a flex program. Based on the 2020 Sanofi Canada survey, 28% of plan members have a flex plan. As expected, almost 40% of employers with more than 500 employees have flex, while only 18% in the under 50 have flex. However, this is the area that we're seeing a huge emerging trend in that small to mid-sized market. So why are we seeing the trend? One of the biggest contributing factors is the workforce's demographics are changing. For example, a recent Deloitte survey showed that millennials place a high value on flex and customization when it comes to their benefit programs. So millennials are between the ages of 24 and 39. And so now we're going to do a little quiz. So I'll have Josefa monitor it. And what percentage of the workforce are made up of millennials? So you can just answer in the chat box. And the first person that gets the right answer, we're going to send you out a $50 Starbucks card. So again, millennials are between the ages of 24 and 39. And what percentage of the workforce do you think they make up? So Josefa, I'm just scrolling through here, but feel free to jump in. We've got some answers that are pretty darn close, but I haven't seen the actual. Oh, I see it.
Yeah, Allison, I think I see the correct answer here.
Perfect. Do you want to announce our winner?
Yep. So the first person to get it was Roberto Fazio, who has guessed it correctly at 40%. I guess you could show that, Allison, but I'll let you keep going. But that was the first person to get it on ours. So we'll note that down, Roberto. And thank you very much for participating.
Perfect. Yes, thank you for playing along. So yeah, the answer is 40% and growing. So because millennials are making up 40% of the workforce, and that's a growing number, employers are trying to find ways to adapt benefit program offerings to meet this changing demographic. One of the best ways to do this is introducing the element of flex. As I previously mentioned, there's really a few different ways that we can do this. The first is utilizing a small employer flex plan that's specifically designed for smaller groups, where each employee gets a budget and they can choose how they spend those dollars based on their needs for them and their families. The second is introducing a healthcare spending or wellness account to an existing benefit program. Plan sponsors may choose to add it on top of the current offering or scale back some components of the current insured plan to free up some dollars to fund health or wellness accounts. And so our next trend that we're seeing, healthcare spending and wellness accounts. The 2020 Sanofi survey shows a huge increase in healthcare spending being offered as part of benefit programs compared to just a few years ago. 57% of plan sponsors reported they currently offer a healthcare spending account, compared to only 33% in 2018 and 31% in 2017. So why such a dramatic increase? Yes, part of it is the younger demographic coming into the workforce, but it's also that all employees, regardless of age, want customization and flexibility. In addition, employees are more educated and savvy than they ever have been, and we live in a world of technology, and the amount of information that people have at their fingertips is endless. So people are much more aware of what options are even available. There are also advantages for the employer. Healthcare spending accounts or wellness accounts are budgetable, and with so many components of the benefit program going up each year, they really value the financial stability that a healthcare spending or wellness account can provide. The employer has control over any increases, and the only reason it goes up is if they choose to increase any annual allocations for the employees. In the same 2020 Sanofi survey released earlier this year, 51% of plan sponsors anticipate that healthcare spending accounts will play a more significant role over the next 5 years. And that's up from only 36% in 2018. Ultimately, it gives employees choice. Technology's made it easier to use and provides a positive experience for employees. There are many factors that go into the decision to look at implementing a healthcare spending or wellness account. Clearly defining your organization's goals, budget, and corporate culture will influence what the right solution is. There's also different tax consequences for healthcare spending account versus wellness. Healthcare spending accounts are non-taxable to the employee. However, only expenses that are approved by CRA are eligible, and they must be medically necessary. Wellness accounts, on the other hand, provide a lot more flexibility. They are taxable to the employee, but the employer ultimately determines what's eligible through a wellness account. Plan sponsors can choose to implement a healthcare spending account, a wellness account, or a combination of both. Some plan sponsors are even giving their employees an annual allocation, and then the employee chooses at the beginning of the year what they want allocated to health spending and what they want allocated to wellness. Blake will touch on mental health later in the presentation, but there's a growing trend of employers wanting to provide employees with resources and tools to stay healthy, both physically and mentally. Reflecting back on 2020, more than ever, people have shown how much they value their health. Just look at the measures we've all taken in an effort to try to stay healthy and flatten the COVID-19 curve. Staying home, wearing masks, buying hand sanitizer by the gallon. If we didn't care about our health, we wouldn't have done any of it. Ironically, many of us have thrown our daily healthy habits of diet and exercise out the window. You can open any social media platform and find countless memes on people gaining 19 pounds this year and calling it the COVID-19. On the other extreme, I recently saw an article on LinkedIn of someone who's lost 19 pounds this year. How do you ask? He has a wellness plan through his employer and purchased a treadmill. And the time that he's saved commuting every day to and from his office, he spends working out in his basement. Whether you fall into the first category or the second or somewhere in between, plan sponsors can help promote and influence the health of their employees through different components of the benefit program and wellness accounts. Benefits are a tool that can be used to communicate corporate culture to your employees. 74% of sponsors will be allocating resources outside of the health plan to some of the following 5 areas. The top 3 are emotional and mental health, illness prevention and chronic disease management, and physical fitness. So at this time, I'd like to turn it over to Blake, who's going to go through the next portion of the presentation.
Awesome. Thank you very much, Allison. That was very informative. I think I fall within the the COVID-19. I didn't lose 19 pounds, so I think I'm on the losing side of that one. Let me just share my screen here, and we'll continue where we left off. Today's awesome. Okay, thank you. So we're going to continue on here. I got the top 5. I don't know how I ended up with that, but so we're going to start with number 5. So Human Resource Information Systems, so also known as HRIS. So for those of you who don't know what an HRIS system is, it's a software that manages employees' data across the employee's life cycle. So they're being put in place for businesses to give them the tools they need to manage their workforce. And that's going from recruitment to onboarding all the way through termination. So most HR platforms provide a number of functionality, which you'll see there. So employee onboarding, everything's done electronically, kind of forgetting those paper forms. A lot of insurance carriers are still requiring the paper beneficiary designation, but in this time of COVID, when people are working from home, if we can get employees enrolled digitally, it makes it a lot easier for everybody, the employee and the employer. Also, so employee record management. So again, we're kind of losing way with those paper files, paper forms. You can keep everything on your HRIS system in a secure location, and a lot of them have high security. So your employees' information is not going to be at risk at all. And also time off management and absence management. This is a huge one, I think. Managing vacation can be difficult. Through HRIS systems, employees can request time off through the portal. Their manager gets a notification and then can approve or deny that request. It just eliminates employers from getting those forms filled out, keeping a spreadsheet of vacation, sick days. It's going to keep that number. The employees can always check that, see how much vacation they have, how many sick days, stuff like that. So super helpful in that space as well. And the most important, I would say, based on this presentation, is for employee benefits. So employees can enroll digitally. They get an email. They can put all their information in, and that gets sent to the insurance carrier behind the scenes. So there's not a paper form, again, unless it's for that life insurance beneficiary designation. And this also eliminates where we see late applicants. So when employees don't enroll within those 31 days, maybe you forget to get the form from them, you don't have to worry about providing medical evidence. So getting those employees enrolled on time is very important. And also updating salaries. As I'm sure many of you are familiar with, if you're updating a salary on the insurance carrier or on your payroll, you have to go to the insurance carrier, you have to do it internally. If you do it on an HRS system, typically that gets sent through to your payroll and to your benefits. So it's a one-stop shop, so you're not doing that. Also, you can upload your employee booklets, their benefits booklets, and the HR policies, so that they don't have to chase around the HR person to get it. You can just kind of go to your HRS system as an employee, pull up the employee booklet or the benefit booklet, and see your coverage if it's not already listed on the portal. So other things like performance management, employee training, HR reporting is all included in most platforms. So moving along. Who are the HRS providers? So here we've included a list. This isn't all of them. These are just a handful of the ones that typically we are seeing in the space. We are no means by HRIS experts here at the Leslie Group, but we do deal with them a lot. So I think that we can provide some good expertise on and some helpful tips on how they can help you, maybe which ones to stay away from, which ones are good, depending on what kind of functionality you're looking for. So again, reach out to your Leslie Group representative if you want some more information on any of these providers, and we can kind of give you our 2 cents on that. So with anything, there are pros and cons. So let's start with the pros of HRIS systems. So as I said, easy onboarding. Everything's electronic, makes it simple. We're eliminating the forms, and with people working from home, it makes it a lot easier to collect that data. It's very user-friendly for the most part. Again, there's more providers than one, so I can't speak for all of them, but most of them, very user-friendly for both the staff and the employer. So you're not having to go through a lot of time training to use the system. It's very user-friendly. You go in, very simple. And it also empowers employees to access data. As I'm sure many of you know, employees come and ask questions about, maybe their benefits or their vacation, or they need corporate policy or HR policy. You can upload that to your HRIS system as mentioned, and the HR person who typically deals with those requests, can spend time doing their actual work as opposed to providing employees information that they have access to elsewhere. So those are the pros. With pros, there's always cons. So here's a few of the cons that we've ran into. Again, this isn't for all, but this is for some. So sometimes there is challenges integrating with payroll systems. Not every HRIS system integrates with every payroll system. So you have to be aware of that. If you're using one for payroll and one for HRIS, there could be some difficulty in that. There has been some reporting challenges. So this is when we're talking, when you're implementing changes onto your benefits plan and it doesn't go all the way to the insurance carrier. If you make a change, that doesn't mean that it's going to get reported to the insurance carrier automatically. We hope it does, and it should. That's the purpose of the HRIS, but we have seen some challenges there with certain clients where it's not reporting correctly, and also with companies that have more than one insurance carrier. So you could have all your benefits with Canada Life, but maybe you have LTD alone with RBC. So there is some difficulty in reporting different divisions, and it just adds that level of confusion. So just some things to keep in mind. If you do have questions, if you want a demo of any of the HRIS systems, we can put you in contact with them. Reach out to your Leslie Group representative. They can certainly assist you in that. My apologies. So number 4 is virtual healthcare. So as I'm sure most of you are aware and have heard, whether it be through your Leslie Group advisor, whether it be through your service person, whether it be through the insurance carrier. So what virtual healthcare is it lets you access your doctor or any other healthcare professional for non-urgent medical care. You can use it anywhere you're comfortable, talking through the phone, video, or chat, whether it be in your home or at your office. Virtual care is not meant to replace your family physician. It's here to act as a complement. And I guess it is there for those who don't have a family physician. We just like to think of virtual care as a walk-in clinic in your pocket, on your phone or on your computer. So according to this stat, and this certainly has to do with COVID, so 60% of primary care virtual visits in 2020, as compared to 4% in 2019. So that's a huge increase. Obviously, most family physicians are doing virtual care anyway, so that's why the number is so high. So here's an interesting stat. 68% of Canadians skip medical appointments due to barriers, such as long wait times, which is incredible, thinking 68% aren't getting the care that maybe they need. So that's a big thing. So I think that, you know what, I'm going to start a quiz here. Allison, I'm going to I don't have it written out just like you did, but let's do another quiz. So what percentage of clinics visits, so typically if you were to go to a doctor, what percentage of those visits do you think can be done virtually without impacting quality of treatment? So again, use the chat box and give me a percentage of what you think the number of visits can be done virtually. Okay. And Allison or Huzefa, I'll get you to kind of do that just because I don't want to pull it all up.
Sure, I can do that. Should we give it? Let me know when you want to put a time cap on it.
I would say somebody's got to get the answer right. So let's just find the first person who got it right, and that's
Tash Chase, I believe.
Yeah.
Yep.
All right. Well, congratulations. We'll jot that down, and we'll get you a gift card over to you as well. So, continuing on, the number is 70%. So 70% of ER and clinic visits can be done virtually without impacting quality of treatment. So I think COVID kind of made everybody get over the discomfort of interacting digitally, whether that's family, friends, clients, colleagues, but now it's doctors. It's going to access medical care through this. 5 years ago, everybody thought it may take 20 years to get here. But you know what? COVID has done crazy things to us. So it makes sense that people are getting more comfortable as well. So again, virtual care is not meant to replace your family physician. It's here to act as a complement. So there's a couple of things, and these are some positives that we like to see in virtual care. So reduced wait times and 24/7 availability. So again, we're not trying to take away anything from doctors. They're doing a great job and doing what they can. But most doctors are typically only working between the hours that their clinic is open most times. So again, this isn't for everybody, but you can access virtual care 24/7 and you don't have to book an appointment, which is fantastic, which also leads to reduced absenteeism. So not only a reduction of disability occurrence if people are getting that medical care, assuming only 68% of those people, based on the last slide, are actually not going to the doctor because they don't want to wait. They're not going to become disabled down the road, but they're also not going to have to take away, half of a day to go to an appointment. I know not everybody on this call is in Toronto, but as I'm sure most of you are aware, is that it takes you half a day to get anywhere in the city. So if you're going to a doctor's appointment, there's a half a day. If you can get people to their appointment virtually and take off no time, they can do it in their office or their home. You save a lot of time. Especially and also with virtual care, you can access specialists without a referral. You can also get specialist referrals from the virtual care. And there's also support for employers, so they can get access to health information, not confidential information about their employees, but they're saying, okay, well, how healthy is our staff? How many times are my staff interacting with virtual care? So there's lots of reporting that employers can get, and there's also support for them as well. So here are the top 5 virtual healthcare visits. So, I'd like to thank Dialogue for providing these stats for us on the top 5 virtual care visits. Dermatology, ear, nose, throat, musculoskeletal, psychology, gastrointestinal. So these are typical things that people would go to a doctor for, but we're seeing them do it virtually, and that makes sense. So in dermatology, you can go say, okay, I have a rash, check it out, take a picture, send it to the virtual healthcare provider, and they can kind of provide some guidance on that. So that completely makes sense. And then speaking of Dialogue, they are one of the virtual care providers in the space right now. There are a handful. Dialogue, Wello, EQ Care, Akira, and Maple are a few in the Canadian marketplace, and Inkblot is also in there. They're strictly mental virtual healthcare, and I'll touch on that shortly. So a number of these providers have actually partnered up with insurance carriers and are now continuing, and that's continuing to be the norm. For example, Sun Life and Canada Life, so 2 of Canada's largest insurance carriers, have recently partnered with Dialogue to bring virtual care to their members. So some of these carriers are making it a standard offering built in, while others are giving clients the option to opt out. So depending on the carrier, there also are other insurance carriers that are, giving you the option to say, okay, do I want it? Do I not want it? Maybe some members want it, some don't, and then there's a price associated with that. So moving along, I'm going to speak a bit towards Inkblot. So Inkblot is a virtual healthcare just for mental health. So it gives employees access to counselors, social workers, and psychotherapists for half the national average. So here's some stats provided by Inkblot based on their service. So we're seeing mild symptoms, a 24% improvement, moderate symptoms, 49%, severe symptoms, 174% improvement of severe symptoms. So, and we're looking at a 98% client satisfaction, and that's the members. These are people that are interacting with the counselors, with the psychotherapists that say, you know what, this is really working for us, and that's great. So the way that I'll just speak briefly on Inkblot and how their service works. So employees get access to counselors, social workers, and psychotherapists for half the national average. So typically, maybe a session costs $150. Through Inkblot, you're getting it the employees get it for $75. So you can put that $75 through a health spending account. You can put it towards your basic paramedical benefits. And then even if you don't have paramedical benefits or a health spending account, the employees are still getting that coverage at a reduced cost. So that there is a cost to employers. For if you're under 100 employees, the cost is $500 a year. So it's not substantial, and it gives you all members access to the platform. And again, there's confidential reporting given to the employers saying, are people using this? Are they enjoying work? Are they stressed? Are they overworked? Are they getting that work-life balance? So there is reporting also, confidential, of course. You're not getting personal information, who's accessing it, or anything like that. But you are, understanding your workforce. So that's awesome. So that's your virtual healthcare providers. Sticking with the virtual theme, I'm just going to move to virtual pharmacies. So we're seeing an uptake in virtual pharmacies. They work just like your pharmacy down the street. It's just only online. So all medication is delivered to your door in most places in Canada. And we've seen a large uptake of this during the pandemic. So why might your organization look at implementing or promoting virtual pharmacies? So they're easy to access. You can sign up super quick. Sometimes it takes less than 5 minutes. They're full service pharmacies, with the exception of narcotics and controlled substances like that. But these pharmacies, they work with your doctor, so you never run out of your medication. And a lot of the time, the medication is sorted by date and time, so you know when to take it. So you're not forgetting to take your meds. And I know that can be a problem for many people. So, and there's also transparent pricing. So typically, the dispensing fee at most virtual pharmacies between that $7 and $9 range. For comparison, Costco is the cheapest out of all. It's $4 to go get your prescription filled. Not a lot of people want to go into Costco, but you don't have to have a membership. You can go to the pharmacy, pay $4 for a dispensing fee, and that's fantastic. If you're going to Shoppers, you're looking at $13.99, $14. So it is a reduced dispensing fee at a lot of these virtual pharmacies. So it also gives you access to your medication history. So if you have a virtual pharmacy, you can go in, see what you've been on. You can share this with your doctor. If you're moving, go into a different physician, say, this is what I've taken for the past number of years. Everything's listed on there. So really great. And so there are a number of virtual pharmacies going into the Canadian marketplace. Here are just a couple: Pocket Pills, My Easy Dose, Postscripts. And most recently, Amazon has entered the pharmacy space in the United States. So they're not quite in Canada, but I know they have filed for a trademark for Amazon Pharmacy. So it's just a matter of time until Amazon gets into the space here in Canada, which is going to have huge repercussions on how people get their drugs. So it'll be interesting to see. So stay tuned for that. So that's number 3. Moving on to number 4 is just drugs and drug plan management and high cost drugs, and how COVID has impacted that. So COVID has impacted reporting of high cost drugs, but there's also a number of drugs coming up the pipeline, ranging from all the way from $78,000 for a rheumatoid arthritis drug, $40,000 to $65,000 for depression medication through a drug nasal spray. Rare eye disorder, $565,000 per eye for another drug. So there's a lot of high cost drugs coming down the pipe. Currently, 30% of drug costs are through specialty drugs. However, they only make up 2% of all claims. But we're anticipating these high cost drugs to rise to 40% by 2023. So we're seeing that more drugs are hitting the market, and that's going to happen every single year and continuing on. But the other problem being is that drug utilization of all drugs is continuing to increase. So these are, diabetes medication, cholesterol medication. These aren't specialty drugs, but the utilization of these drugs are continuing to increase. So we really want to, promote employees to be smart shoppers, and it kind of goes back to the virtual pharmacy. If you can save, $5 or $10 here or there going to the virtual pharmacy, maybe for one drug that's not a lot of money, but at the end of the day, if every employee is going to Shoppers Drug Mart or their pharmacy down the street where the dispensing fee is $17 or $15 instead of going to the $4 Costco or the virtual pharmacy of $7 or $8, those numbers all add up. So we want to be cognizant of that. And especially with COVID, it's had its own impact on drug plans. So for those of you who joined us with Martin Chung back in September, it would have been for our drug trends seminar. This is a big impact on how we're reporting drug usage over COVID. So the government reduced it to a 30-day refill limit. So every time somebody had to go get their drugs every 30 days, as opposed to 90 days. So every time they're going to Shoppers or they're going to their pharmacy, they're paying that dispensing fee. So that's going to hit the plan. So when it comes to renewal, we're going to see an increase in the drug spend. Also, we're seeing increased spousal and dependent claims due to job loss. So when a spouse loses a job, or their benefits are pulled back, they're going to their other spousal plan, and then if they have any medications that they're on, they're just hitting that plan. So it's not going to affect everybody, but it could affect a good number of groups. And also acute drugs. I mean, we're not seeing the same people. Surgeries are being delayed. There were less car crashes. There's lots of drugs that aren't being used throughout this. So we anticipate drug usage to go back to normal levels. Again, it's opening up now. So we're anticipating those drugs to see. So we'll see that in the next probably 2 to 4 months, and we'll see how that's impacted the drug plan. And then COVID specific drugs. How is COVID impacting the drugs specifically? So, using existing drugs to treat COVID, spending on COVID specific drugs, and then the 30-day refill. So are these COVID drugs the new norm? What's going to happen to drug plans? It's kind of a question mark. So again, we're going to see what happens in the next 3, 4, 6 months. So definitely going to continue to keep an eye on that, but it's one thing to be cognizant about when looking at your drug plan. So this is our final slide, or not slide, our final topic. And I'm sure everybody has heard mental health go around for a while. It's been around, it's making a bigger impact than ever. So we put it at number one, and it also relates back to a lot of things, whether that be the virtual pharmacy, the virtual healthcare. There's a lot that this has to do with disability and continuing. So according to Canada.ca mental health during COVID, 24% reported fair or poor mental health compared to 8% in 2018. So 24%, it's not a huge number, but it's 3 times as much since 2018. So pretty significant increase. 52 said mental health has worsened during COVID. And I'm sure a lot of you have heard these stats, but I just want to reiterate them. So 88% experience at least one symptom of anxiety. And there's just been higher anxiety among those who have been financially impacted by COVID. So financial stress is the number one stressor of all. So there's financial, there's workload, there's work-life balance that are really important in dealing with stress. Financial is number one. So not only are you financially stressed, but you could also maybe be stressed about losing your job, or you already had debts, or you have a mortgage. There's a number of things that are causing stress for people, anxiety, and that's going to impact your plan. Well, not only your plan, but your business. So productivity. So 36% worked less due to stress. And that's measured in, employees either coming late to work or leaving work early. And then 41% took at least one sick day in a year due to stress. These are all stats from January 2020. So these are pre-COVID stats. We're going to see this increase significantly. And of these that missed work due to stress, typically it was an average of 5 times. So if they were missing one sick day a year, it was an average of they were missing 5 sick days. So it was at least one. It's impacting disability. Mental health is the growing is like the highest incidence of disability is due to mental health. And we're seeing carriers rates increase anywhere from 30 to 200%. I mean, this isn't everybody, but disability is getting impacted by mental health. So we want to keep your employees healthy. We don't want them to be on disability, for one. So this is the way that it's impacting you, and also on drug plan utilization. As I said before, the less drugs we have claimed, the better the plan's running, the more affordable the plan's going to be. If everybody's on drugs or taking medication, costs are going to go up, and it's going to impact the plan. So kind of just to harp on that, so it's investing in mental health is going to be higher productivity and lower absenteeism. First of all, people are going to be happier at work, and if they can access care, whether that be through a virtual care provider, whether that's through an EAP, employees aren't going to leave work to go to appointments, and they're not going to have to be absent from work, whether that be on disability or sick days. It's also going to affect your attraction and retention. So as I'm sure many of you know, hiring people is difficult. Finding good help is hard to find. And there's a cost to that. It takes a lot of time to retrain people, to hire people. So if you can attract and retain those employees, you're going to be a better business. Your employees are going to be happier. And just the overall well-being of your employees. Again, happy employee is a good employee. They're going to stay employed. They're not going to want to move to a company that's offering better health benefits or doesn't understand mental health or whatever it may be. So I think it's very important for us to look at mental health as an aspect of your plan that you do have some control over. There are resources available that we can help you with, and there are also resources available that are free. So it's not just you have to pay to get. So Canada.ca, so a government-run website, has a Wellness Together portal that every Canadian has access to. There's no cost. There's resources there for mental health. So I highly encourage you to share this website with your staff, saying, you know what, we understand it is tough times. We're in it together, but some people need those extra resources. So whether that's through, virtual healthcare, virtual mental health care, or through this Wellness Together portal, there's lots of other options, even an EAP. So with that, that is all I have for everyone. I really want to thank everybody for joining today, and for the previous seminars as well. It's been a lot of fun. We've learned a lot building these, and we hope that you've learned a lot attending them. So with that, I will pass that back to Josefa. You can, I don't know if there's any tough questions for Allison and myself. We'll try and answer them the best we can.
Sure.
But,
thank you again. Just
other than that,
reiterating.
thanks.
Sorry, thank you. Sorry, I didn't mean to cut you off, Blake. Just want to
It's
reiterate.
okay.
Thanks to everyone. There is an interesting question that came up from Annie, and I might just ask Alison to jump in because I think it'll be a good question for the rest of the group. Just comparing EAP to virtual healthcare and the difference between the two.
Yeah, so the question popped up when Blake was going through Inkblot and their offering in virtual mental health. And the differences between EAP and Inkblot is EAP is more of a robust offering in that it's everything from work-life balance, stress, family issues, buying your first house, having your first baby. It's almost like a personal overall wellness, whether it be health, a component of physical health or a component of mental health. So one of the components of an EAP is counseling. So that's where there is potentially a little bit of overlap, but EAPs traditionally only cover short-term type of situations. So it will vary depending on the provider, but there might only be 3 to 5 sessions depending on what the issue is. Inkblot, on the other hand, just specializes in that mental health component and offering longer term resources at a discounted rate. So if employees do have paramed coverage for psychology or a healthcare spending account, if they have Inkblot, they're getting those sessions at half the cost if they didn't have Inkblot. So the advantage is if they have $500 of psychology coverage, that money will go twice as far.
Fantastic.
Yeah, so hopefully that answers Annie's question, but if you want us to expand on it, happy to connect after the presentation as well.
Great stuff. Do follow us on LinkedIn. We post all our future webinars on there. We put our newsletter up there, special articles, interesting facts about what's happening in the industry. You can obviously come to lesliegroup.com. There's a webinars page, all the dates are listed, registration pages, and so on. I really like LinkedIn. It's just a good format. So just hit follow. Sorry, Blake's laughing at me. Do come to our website though.
No, I like it. No, I'm with you. I like it too. Perfect. Okay. Well, is that all the questions that we have, Josefa?
I think so. Yeah. Yeah. I think there are a few questions that came in, but a lot of them you answered as you were going along, and same with Allison. So,
okay.
As is often the case.
Perfect. Well, I'd like to thank everyone for coming and also congratulate our 2 winners. So Roberto Fazio and Tash Chase, congratulations. So we will be reaching out after the session and sending you your Starbucks card virtually.
Fabulous. Enjoy your coffee or whatever else you get.
Awesome. All right. Thanks, everybody.
Thank you so much. Take care. Have a great weekend.
All right. Take care.